Welcome to Mulready Minutes with Oklahoma Insurance Commissioner Glenn Mulready. This is a podcast about insurance for insurance folks, risk managers, and business leaders. We'll dive deep and look at what is and isn't working, talk to leaders in the industry, and keep you informed on what's happening in Oklahoma and around the country.
Welcome to another Mulready Minute. We are thrilled today to have a special guest, a literally renowned expert in a certain field, and so we're going to kind of get into the weeds on that today. But Katy Spangler is with us today. Welcome to our show.
Thank you so much. Pleasure to be here.
Good to have you here. Let me quickly just read through some of your bio, because a lot of people may not know who you are. But Katy is the principal of Spangler Strategies. She brings a deep expertise in healthcare policy, advocacy, and coalition building to address a range of healthcare issues. As part of her work with Spangler Strategies, she's also senior advisor to the American Benefits Council and the Alliance to Fight the 40, a coalition established to protect employer-provided health coverage. With a background including roles in senior health policy positions and co-founding VBID Health, Katy is a recognized authority, frequently sought after for her insights and expertise in this field. And that's exactly why we're here, is to seek out her expertise in this field. And I might add that in previous conversations I've had with Katy, she goes back to the ACA days and Senator Enzi on staff there with the Help Committee in the Senate. And so we are thrilled to have you on with us, bringing your expertise. So the topic of the day really is HSAs, or health savings accounts, and you bring a lot of depth of knowledge there. So first of all, we've got insurance, folks that watch, but also just for consumers. What is a health savings account?
Great. So a health savings account is a tax-advantaged account that allows you, if you're enrolled in a qualifying high deductible health plan, you are allowed to make contributions to a health savings account or receive an employer's contributions to a health savings account. And this allows you to put pre-tax dollars into this account.
And health savings account came about where, when? What's the genesis of that?
Yep. So they date back to 2003. And I should say I was remiss in not mentioning and thanking Senator Don Nichols from Oklahoma, who I actually worked for in 2003 when Congress was debating the Medicare Modernization Act. And he was on the Senate Finance Committee and was also on the Conference Committee as that bipartisan piece of legislation was enacted in 2003. Part of that, it created the Part D prescription drug benefit for seniors on Medicare.
Which we're all familiar with now.
Right,
Now.
exactly, yes. And it also created health savings accounts. It was kind of a smaller provision of a bigger piece of legislation, but really important. And it created this new benefit within the tax code that created these tax-preferred accounts for which you need to be enrolled in a qualifying high deductible health plan in order to make or receive a contribution in these accounts.
Okay, so having been in that space for years myself, lots of confusion in when I say in the marketplace with consumers. FSA, HSA. Do you want to touch for a minute on the differences there? So if someone's thinking, wait, I know what an HSA is. I've had one for years.
Yep. I like to think of it as alphabet soup. There's so many acronyms in healthcare, right? And so a health savings account, an HSA, is a health savings account. That's your money, right? You invest your money, you keep it. As long as you're using it for a qualified medical expense, you can use those benefits without paying taxes on them. That's very different than a flexible spending account, or an FSA. That is money that you are allowed to put in. There's a certain amount that you can put in on a pre-tax basis, but then you're only allowed to roll over a certain amount for a certain amount of time. And so if you don't spend all of that money by that certain timeline, then you lose that money. And so it's, sometimes not as beneficial if you're maybe not spending as much on healthcare, and you could then potentially lose that money. Versus a health savings account, that money's going to roll over from year to year. That's yours. It's in your account to spend on qualified medical expenses.
Right. And I bring that up because FSAs are a lot more widely used and recognized or available with employers more so than HSAs.
And I think that's because in order to enjoy that tax benefit of the health savings account, you have to be enrolled in that high deductible health plan. versus an FSA, you can couple that with any plan that you would have. Just you can't have a flexible spending account or an FSA and a health savings account or an HSA. You have to pick one or the other.
Yeah. Okay. And so I know that things have progressed. Personally, I've been on an HSA plan for at least 15 years. But talk to me about sort of the uptake or what that has looked like for a market share with HSAs, 15 years ago versus today.
Yep. And I should say, so health savings accounts turned 20 last year, actually, right? So 2023, they were created in 2003. So 20 years that they have been in the market, and there are about 35 million accounts that exist. So the estimates are they cover about 72-ish million people, because usually each account serves more than one person, right? So we have one account in our family, but we're a family of 4. And so when you look at that math, it's about 72 million people benefit from health savings accounts.
Okay.
That's a lot.
Yeah, it is a bunch. And I know with the state plan here, I can't quote you the exact numbers, but back when I first enrolled, and I came from an HSA when I became a state employee, but the uptake was very, very small. But I was sort of a cheerleader for HSAs to folks, and all I would say was, it's just math. Do the math of what that premium cost is. Tuck that into your cookie jar, if you will, your HSA cookie jar, but just do that math, and it usually works out in your favor. So I know there's been a much stronger uptake within the state of Oklahoma employees as well for HSAs.
Yeah, that's great. I think maybe some people don't realize that you can actually invest those HSA dollars in different, we invest ours, for example, in 2 different mutual funds that have really low fees. And so we've benefited from the compounding interest that's accrued as we've made contributions ourselves, and then we've enjoyed contributions from my husband's employer as well.
Yeah, and so that's a good segue into, you hear often the sort of double or triple advantage of HSAs. Maybe you can talk about those different tax advantages that you do get to experience.
Yep. So health savings accounts are actually the only thing in the tax code that enjoy the triple tax advantage. So the money is able to be invested on a pre-tax basis. You put it in pre-tax, it grows tax-free, and then you're able to take it out without paying taxes on it as long as it's for a qualified medical expense. So nothing else in the tax code enjoys that triple tax advantage, which really makes health savings accounts a great thing for consumers.
Yeah, I even corrected myself. I said double because then as soon as I said that, wait, no, I remember it's a triple.
It's very rare, so it doesn't roll off the tongue as much.
And people aren't quite aware of that. And then something else that folks aren't unaware of a lot of times is sort of post 65 or Medicare use of HSA. Can you talk about that, how that's impacted and what you can do with that?
Yeah, so a couple of things here. So it gets, there's more flexibility once you've turned 65. You typically can't use health savings accounts dollars to pay for premiums. But you can use it to pay for long-term care premiums, for example. So there's a little bit more flexibility once you turn 65. You can also use it for non-medical expenses once you turn 65. One thing that is different, and this is something that folks are working on in Washington, D.C. to try to correct this, is that if you turn 65 and you have elected to take your Social Security benefits before you turn 65, so let's say maybe you're a lower income senior and you need to take your Social Security benefits early, but maybe you kept working and maybe you work for an employer that has a health savings account. They even fund that health savings account for you. Because you took your Social Security benefits before you turned 65, once you turn 65, you're automatically enrolled in Medicare Part A. There's really nothing you can do to change that. And then once you're enrolled in Medicare Part A, that's considered disqualifying coverage for being able to receive a contribution to a health savings account or make a contribution to a health savings account. And so that really can disadvantage lower income seniors that might need to elect to take their Social Security benefits early. And so there's legislation in Congress to correct that. There was the House Ways and Means Committee actually passed a bill that would have made that fix for Medicare Part A to say just because you receive Medicare Part A doesn't mean you're disqualified from being able to make or receive a contribution to a health savings account.
Mm-hmm. So you mentioned in that spiel there, employer contribution, employee contribution. I know not a lot of employers will often contribute to an HSA, but I had lunch yesterday with someone whose company here in Oklahoma City contributes a certain percentage of every dollar that you contribute to an HSA. How common is that, or what do you see out there?
Yeah, so I think it's about a quarter of the HSA contributions actually come from an employer. So it's that's a fair amount.
More than I would have thought.
Yeah. So I think that's just another reason why I think that people should really give health savings accounts and the plans that you have to be enrolled in to make and receive a contribution a second look, because there are employers out there that want to help the employee afford their deductible, right? And so that is one of the trade-offs, right? Mm-hmm. If you have a health savings account, you're also in a higher deductible health plan. And so some employers have said, hey, our premiums are going to be a lot lower in these HSA eligible plans because they do have a higher deductible. So it's better for us because employers usually pay about 75% of the premium. So if the premium's lower, the employer's going to save money. Mm-hmm. And the employers have said, we're going to take that savings and we're going to give it back to our employees in the form of contributions to their health savings accounts. And so that was kind of what was envisioned when these plans were created, was that it's an opportunity for someone that maybe is okay knowing that they might have a slightly higher out-of-pocket cost later on, but enabling them to pick a plan that has a lower premium because they have a higher deductible.
Yeah. I think an upside, too, that I've talked a lot about over the years is the old cliche, you have skin in the game.
Right.
And so, for my family, just speaking personally, once we're on an HSA, we became a little bit more engaged in that healthcare conversation. I remember specifically going to a doctor. I was running a lot at the time and had a foot problem, and they did an X-ray and it didn't show anything. Wanted me to go have some kind of imaging scan, and it was about $1,500. And I asked how much it cost, which was pretty rare in our world right now. Doctor couldn't tell me. Had to get back to me on that. And when I was on the phone, I said, well, look, it seems to me like some kind of hairline fracture may show up, but it didn't show up in the X-ray, and you're going to tell me to take Advil and stay off of it. And if nothing shows up, it still hurts me. You're going to tell me to take Advil and stay off of it. And he said, well, you're right. So we did not do that. But that's an example of engaging in that healthcare process that I think HSAs and that high deductible sort of incentivizes. You just become a lot more conscientious of how you're spending those healthcare dollars.
Right. That's exactly right.
Let's talk about as we're going to wrap up here pretty soon, but the regulatory side and law changes. I know, gosh, I'm going to date because years just have flown by and the pandemic messes up my years in my head. But, they expanded the preventive services. Yep. So we haven't really talked about preventive services and first dollar coverage. Talk some on that, and then we'll segue into some regulatory changes or what's being proposed out there.
Yeah. So great question. So when Congress was creating this health savings account program in 2003, they recognized the value of preventive care, right? Benjamin Franklin, an ounce of prevention is worth a pound of cure. Congress saw that wisdom, and so they created this safe harbor for preventive care, which meant that if you are going to be screened for cancer or diabetes, you can those screenings can be covered on a pre-deductible basis. Yeah. And so there was a pretty narrow safe harbor for preventive services.
It's the situation where you're allowed to have 100% coverage, not meeting your deductible.
Right. And it's actually up to the plan or the employer. And so if they want to say, hey, it's going to be $5 for you to find out if you have diabetes screening, for example, or they can say it's totally free to the employee. So it's up to the plan or the employer to how they structure their plan. But they are allowed to offer these things pre-deductible. Of course, when the ACA passed, there was a provision in the Affordable Care Act that said that you have to cover certain preventive care without any cost sharing. And then that also applied to health savings account plans as well. So for a long time, it was a pretty narrow definition starting from 2003 that expanded once the ACA passed in 2010. And then in 2019, the Trump administration published guidance to further expand that definition of what was considered preventive. I think there was a recognition that 90% of the $4.5 trillion our country spends on healthcare is to help manage chronic conditions. So if we can do a better job of managing those on the front end, maybe we can save a little bit of that 90% that we're spending on them.
Right.
And so they wisely expanded that definition of preventive care to include chronic disease prevention. And there were 14 items and services that they said could be offered pre-deductible, and someone would still meet all the rules governing health savings accounts.
Yeah, that was very helpful for a lot of folks. So in the regulatory world, anything else being proposed in Washington, or talk of expanding that list of preventive services? What's happening out there? What's happening in D.C.?
Yeah, always lots happening in D.C. So there is work underway to try to expand that list of 14 items and services in the chronic disease prevention space. Things like mental health counseling, naloxone for substance use disorder, things like that, really high value things, right, that should be allowed to be covered. And again, it's not a mandate to cover these things, which I think is a really important distinction. It's flexibility to cover them.
That is an important distinction, because I wasn't aware of that.
So not a mandate. It's just flexibility. And, we said all along, dating back to the Obama administration, we said, hey, if you just give employers and health plans the flexibility to cover these things, we really think that they will. And we met with them so often and so frequently. And then in 2019, they said, okay. And then we did some studies in 2021 to see, okay, so we said that the employers would do this. Did they do it?
Did they indeed? Yeah.
And we got data back showing between 75 and 80% of health plans and employers that responded actually made changes to their plans to cover things like insulin pre-deductible or, beta blockers for heart disease or things like that. And so, it's really hard to get people to do stuff, but the fact that we got 75 to 80% of employers and health plans to cover more benefits in a better way for patients, we're really proud of that work.
They saw the value in that.
Yeah.
Yeah. So anything specific on expanding, or just some conversation there in D.C.?
Yeah. So conversation there. There's a couple of bills that the Ways and Means Committee reported out. And, we appreciate Representative Hearn from Tulsa for his support of that legislation. So there's a bill called the Chronic Disease Flexible Coverage Act that was reported out last summer of the Ways and Means Committee. And that would allow more chronic disease prevention pre-deductible. There's also a bill called the Telehealth Expansion Act that would allow for telehealth services to be offered pre-deductible. So this was temporary flexibility that passed as part of the CARES Act in 2020 to allow telehealth to be covered pre-deductible.
Generally across the board?
Generally across the board, but it was most important for these high deductible health plans that are covered with health savings accounts. And again, it's flexibility to do so. So it's not a mandate because right now these rules that govern high deductible health plans are pretty rigid. And so in 2020, we got that temporary flexibility. It lasts through the end of this year. And so that Telehealth Expansion Act would make that permanent. And so we're really hopeful that that could pass because, as you know, with the pandemic, a lot more people have used telehealth. I think especially with the mental health.
Fast forwarded that.
Right, exactly. I think especially with the mental health crisis and the lack of providers, if we could do more mental health through telehealth, I think that really broadens access to mental health. And so we're hopeful that that could pass this year.
Yeah. Good. Super helpful information. Yeah. Katy, with that, we're gonna wrap up. I thank you for bringing your clear expertise in the healthcare space. And I might just mention, Katy, all those years in D.C. on staff, and we are blessed that she has chosen to relocate to Oklahoma. So she has that expertise, and she's right around the corner.
Yeah.
So we're grateful for that. We look forward to working with you.
Yeah, Thank you. Appreciate the invitation and appreciate all that you do for Oklahomans.
Good. Thanks for being here. Well, that wraps up this edition of the Mulready Minute podcast, where we are digging deep into the weeds of HSAs. Thanks for joining us. We'll see you next time.
If you found this episode informative, please subscribe and share with your colleagues. Visit oid.ok.gov/podcast. Let us know what topics you would like to hear about on this podcast. Until next time, take care from the Oklahoma Insurance Department.